Good afternoon. My name is Maggie Aziz, and I'm the Program Director at Dining for Women. And today I am joined by Dr. Mahmoud, who is the President and Founder of our May featured program, Hope Foundation for Women and Children of Bangladesh. And we also have Ashley Pugh, who is the Program Officer of the organization as well. And as always, we have Laura Haight, the Communications Director at Dining for Women, in case any kind of technical difficulties arise. So thank you both for being here today.
Thank you for having me.
Awesome. So to go ahead and get things started, Dr. Mahmoud, if you want to tell us a little bit about the organization. I know you have a presentation set up to show us.
Sure. So thank you, Maggie, for organizing this, introducing me and the Hope Foundation. And I have a presentation, a slide presentation. I can go direct to that. Can you see?
I can. That's perfect.
Okay. Hi. So thank you again. And I just briefly, I am a pediatrician based in Miami, and I am from Bangladesh, and southern part of Bangladesh, which is Cox's Bazar. And I've been in the States practicing for about 20 years, and I have a very passionate about pediatric health and maternal health. So 14 years ago, I established this organization, Hope Foundation for Women and Children of Bangladesh, in the United States. Our mission is to give healthcare to the poor and needy women and children in rural areas of Bangladesh, because we have found that that is the most vulnerable segment, particularly women and children. In the past 14 years, we have built some capacity in the area. We have a 40-bed Hope Hospital. We have 8 rural medical centers in different parts of the southern part of Bangladesh. And we also have a training center where we train midwives. It is funded by Japanese government. Our hospital was established through donations from Bangladeshis that has immigrated to US. I was able to reach out to them, and they have supported to build that hospital. We have serviced over 500,000 people since we started. Actually, our hospital itself was started in 2005. Before that, we were running a one-room outdoor clinic for about 5 years before we started build that hospital. So we work in a district of Cox's Bazar, which is in the southern part near Myanmar border, and we have a catchment area of 500,000 people, but overall district population is about 2 million. So hopefully in the years ahead, we can reach most of them and go beyond. So I would like to give a brief snapshot on maternal health in Bangladesh and Cox's Bazar. So usually the average age for rural women to get married is 15 years, and they have their first child in 18, which is very young age. And most of them, over 90% of them, have their birth at home through the help of untrained birth attendants or family members usually. They are very skeptical to go to hospital. There are many reasons, and it's a broad topic of discussion, but one of the main reasons is that there is lack of access to healthcare facilities. There are about 50% are malnourished women. That also put them at very high risk. Maternal mortality is 194 over 100,000, and morbidity about 970 over 100,000. So that tells us that the mothers at very high risk. We will talk about obstetric fistula today because that's what we are working with at DFW, Dining for Women. In Bangladesh, there are about roughly 71,000 fistula cases. This is the statistics from Engender Health. Every year we have 2,000 new cases. In past 8 years, from 2005 to 2013, USAID funded 5 centers in Bangladesh. It's not including us, but 5 other centers. that ranges from 200 to 1,000 bed hospitals. In past 8 years, they have done 1,178 cases. There are a number of factors why the number is so small. We can, if we get a chance, I'll address that also. It is estimated that in Cox's Bazar, the number of cases is about 5,000, maybe more or less, but about 5,000. I just want to mention that there are two pockets of, two areas of in the country. One is in southern part, which is in Cox's Bazar. There is another district called Sylhet, which is in the eastern part. These two are the highest area of maternal mortality and fistula cases. Why the fistula? The fistula is basically, it links with our mission of helping the women and children. We started this organization to help the mothers because we think that they are very high risk. So fistula is very much linked, because fistula is a disease of poverty, because they can't get to the hospital on time, or they don't have the means to go there, and also it happens to the poor people, poor women. Since our mission is to help the mothers, so we thought the fistula is very much linked with our mission. That's why we address the fistula issue. So Hope Fistula program actually started in 2010. It started with a partnership with the Fistula Foundation in California. They have been like our biggest and only partner in fistula work so far. And with their help, we have performed 126 cases in last 3 years. And we have our surgeon. We recruited, to their help, we recruited a OB surgeon who we later trained with fistula cases. We sent him to Ethiopia, with one of the largest fistula center in Gandor, where the fistula actually the largest center in the world. So we sent him there to train our surgeon. So we have a full-time surgeon who is also being certified by FIGO, Federation of International Society of Gynecology and Obstetrics. So the number of fistula cases we did is 126. If you notice that in 8 years, that other 5 centers did 1,178 cases. So we have done pretty good number, I think, and thanks to Fistula Foundation for their help. So our resources now, as you say, Dr. Biswas, who is trained in Gondar, Ethiopia, and we have visiting surgeons and nurses that help us. One of them is Dr. Stephen Arrowsmith, who is a world-renowned surgeon, who also is with Fistula Foundation. He has visited our centers so far 5 times. He usually goes twice a year to help us and train our staff. Dr. Muleta is also from Ethiopia, and she was also trained with Dr. Hamlin. Dr. Arrowsmith and Dr. Muleta both were trained with Dr. Hamlin, who is basically the biggest name in fistula work, who built the Hamlin Center in Ethiopia. And also we get help from a nurse and Jackie Smith from Australia. We have 78 staff with Hope Foundation in our hospital and the clinics. And as I showed that in slide, that center that we train midwife, we have 30 students. They are in 3-year program. And our ultimate goal is to train 250 midwife students, because they are the one who can actually prevent fistula. And they will be working in the rural area, and I think they will be the biggest resource for us to prevent fistula happening. We have trained 200 community health workers, and then they are in the field. And also we have a Mothers Club. I will tell you about that a little bit later also. Mothers Clubs are basically the clubs that we have around our rural health center, and around our hospital. And there, in each club, there are about 30 to 40 women, and they're just housewives, homemakers. So this is a picture from our recent fistula camp that happened last month, and Dr. Arrowsmith was there, and some of our patients in hospital bed. Our hospital is not really fancy. It's a community hospital. It's a basic hospital. We have basic services. As I want to mention that Hope Foundation, we all do all our work mostly through small donations from individuals. So we don't have like big grants or anything to build a big hospital, but we can meet the need of the rural area. Our goal is to perform. Right now, we're doing camps. Like every camp, we do 20 to 30 cases. But our goal is to do sustainably every week or every month certain number of cases, and to exceed 100 per month, per year. That is sort of international standard that any hospital does over 100 cases a year. They basically a center of excellence for fistula care, because fistula surgery is difficult, time consuming, and very expensive. So not easy to do large number of cases in any hospital, but our goal is to exceed 100 and having a capacity of 40-bed hospital. So that I think is a good number. We will prevent cases, of course, and that's our also goal. We estimate that with the funding from Dining for Women, we probably can prevent over 100 cases a year. So we expect that we'll prevent at least 700 new cases in 5 years. And we'll create awareness of fistula and safe delivery. And also we are working on a Hope Maternity and Fistula Center in next 2 years. That will be where we'll do most of our work, our obstetric work and fistula work, surgery and prevention. It will be built in our ground, in our campus. Our strategy is basically like a number of ways we do work, fistula work. Mothers Club that I mentioned, we have about 1,140 members. That these are all housewives, like homemakers in rural areas. So they are basically they meet and they discuss about health issues, how Hope can help them, and they take our message to the more deep rural areas and the areas that are hard to access. Our midwives will graduate. First batch will graduate 2016, 30 students, but we're working on taking subsequent now batches. This program is fully being funded by British government, and this is the first program in Bangladesh. And British funding, they have chosen 6 centers, and in southern part, our Hope Foundation and Hospital is the only center. So we hope that in next about 8 years, we'll produce about 250 midwives who will be working across the rural areas everywhere in that district, because they're being recruited from the rural areas. Community health workers, I mentioned about 200 community health workers right now working for us in the deep rural areas, and we do workshops, network with the village doctors, pharmacists, traditional birth attendants, and of course we work around our community of 8 Hope Medical Centers. So these are like the mothers from the Mothers Club. They get together in different time schedule, like Dining for Women. You all get together, and they get together and they talk about their issues. So I just want to share one story of Sanwara Begum. She didn't get the surgery yet when the story was taken, and she is 30 years old. And when she was 13, she was married. And when we asked why her mother went to get married, wanted to have her get married so quickly, so early, so she said that it's just their luck. That's what happened, and she had to spend some money, which is 1 lakh, which is about $1,300 in the US dollars. So also her family was poor. And when she was in labor with the first child at home, she felt the baby wasn't able to come out. After one day, her husband and mother took her to the hospital, where she discovered that the baby was dead. Then started, the baby was of course delivered, a dead baby, stillbirth, and then since then she started the incontinence. And of course, she was socially isolated. And she was divorced, and she came to Hope Hospital. She came in April, and later she got the surgery. So that's her story. So this is just a quick, brief slideshow telling about our program, but I can go back to Maggie and the audience.
Thank you, Dr. Mahmoud. You actually answered a lot of the questions that we had for you in that presentation. It was really, really informative. The one thing that I wanted to kind of expand on was actually in regards to the story that you just said. One of the things that we like to know is what success really looks like in regards to your organization and the things that you are doing to help these women. So to you, what does success mean?
Success of the program, our fistula program, is basically start with the challenges. Right now, the challenges that we have is I'll just give a couple of examples. One is that until we started, I started doing fistula work in 2010. I really didn't have a good idea. Being a doctor, I really didn't have any good idea about fistula. I heard about fistula when I was in medical school and I was doing my internship. Then I became a pediatrician. Then I didn't have a good idea about fistula until I heard in 2010 that one of the visitors from US volunteer went there, and she came back and told me she was a midwife and a doula. She told me that, you know what, there are fistula cases that I have seen. So I started doing thinking about research about it, and I found out that the fistula, a lot of people in the area, they don't know what fistula is, and even medical community, doctors and nurses and the health workers, they don't know what fistula is. So what happened is that fistula patients, they have fistula and they can't tell anybody, and they think that it's a curse. So that's a big challenge to awareness. People don't know about the fistula thing. That even the fistula sufferer, they're suffering, they don't know that there is success, there is help available. So that is so we want to success. Part of the success will be overcoming that challenge. Let everybody know that there is a fistula is an issue. Fistula can be treated, and fistula patients shouldn't be left isolated. They should be integrated in the community in any form, shape possible. The other success will be, as you see, as I mentioned, there are low number of cases happening around in the country. Like the centers they did about 30 cases per year per center. So that is not a good number. So if you have 71,000 fistula cases in the country and 5,000 in Bangladesh, if we can do 100 cases a year, then we have 50 years of work to do if we want to address all of those. The success will be basically in increasing the number of cases. Right now, everybody is doing 30 cases or 40 cases a year. We want to do 100 cases minimum.
And why is that? Why is that number so low right now?
Number of reasons. First, the doctors that in Bangladesh, they have, I don't know, maybe Bangladesh has 40,000, 50,000 doctors. Most doctors don't know what fistula is. So, and even our center, we didn't know what fistula was. Even our government hospital in the area, they don't know what fistula, how to treat fistula. So fistula is a complicated surgery. So that's one, because lack of human resources. Fistula is expensive. To have a safe birth, a normal birth costs about $100 to $200. A C-section will cost $300 to $300 in Bangladesh. A fistula surgery will cost $2,000. So this is, and poor people, they can't pay. So we have to find donors, funders like Fistula Foundation, funders to support this surgery. That one thing. The other thing I mentioned that most of these fistula patients, since they don't know there is a surgery or treatment available, and most of them, they think they think that it's their fault. So they don't come to, they think that it's having a baby is their fault, and they actually get the blame from the community because somebody gets blamed for everything, right? So they get the blame. They think that is their luck, their fault. They don't want to come out. Even if we have a very big issue of actually finding this patient. We find them, we talk to them, and when we schedule surgery, sometimes they don't show up. You call them and they will make excuses, I'm sick or I don't have money. People will tell them that, we'll help you because Fistula Foundation gives us money to bring them to the hospital. to tell them that, and they think that, their family, other family members, they'll think that, I mean, it is too difficult. And if I want to share that fistula, uh, unfortunately, don't get better in one surgery sometimes. First time success is 20 to 30%. There are cases that they need 8, 9 surgeries. So when you want one woman in our hospital get 2 or 3 surgery and they don't get better, they go back to the community, right? They will tell them, you know what, there's no point. But they get better with multiple surgery. But sometimes it is hard. So that's why awareness is a very important issue of our fistula program. And I think,
in regards, sorry for interrupting, that actually takes me to my next point. Then how do the mothers clubs kind of play into that, into helping the outreach efforts?
Mother club, basically, when we do the meeting with the mother club, we basically tell these mothers that, look, fistula, we can take care of it, we can help them, and even if it takes 1 time, 2 time, 3 time, don't get disappointed. Always keep hope. That's what we tell them. So that's what they send the message. And we tell them that we have doctors not only from Bangladesh, we have doctors coming from America. Doctors, because in Bangladesh, what happened, because people are poor, when they get overseas expert come, they have a lot of, they come to that center, and it's basically counseling, awareness, telling them it's not your fault. It's not your fault. It happened, and we can fix it, and we have funds to help you. You don't have to pay.
So then, how would the DFW funds be used specifically?
Well, DFW fund will be. I think it is a blessing that it happened, that our partnership with DFW, because awareness is building awareness in the community is the key. So DFW. Fund will help in several ways. First of all, we'll build a specialized team, which will have we already have the surgeon, so we'll have an assistant for that doctor, because for one person it's not easy to do many complicated things. We need someone to support him when he is away, or he's mild cases this new person can do. We need a outreach coordinator who will go to the community, a coordinator, and a nurse who will train in fistula cases, because fistula nurse, they know things that regular nurses don't know. And Jackie, the Australian nurse, she went and she gave us some help our nurses. But we want to build that team. That's number 1, right? Number 2, with the fistula, the Dining for Women funding, we're gonna do through this team and to our community health workers, to our mothers club, we're doing extensive outreach. So people, every corner of the district, they know that fistula is a term. Then they will know what fistula is, because awareness, when they know that fistula has a care, we can take care of fistula, they will send their patient to our hospital. And other thing is that many of the centers couldn't do big number of surgery because of their lack of outreach program, because it's hard to find fistula patient. So DFW fund, Dining for Women fund, will definitely help in that regard. And also, Fistula Foundation give us funding for surgery. Any number of surgery we want to do, 100, 50, 200, they will give surgery. So we can use the Dining for Women funds to find patients, to create awareness. So we can do more surgery. As I said, our goal is to do more than 100 cases. It can be 200, 300, I don't know. But our goal is to exceed 100.
That's awesome. We are really, really excited about this collaboration, and all the information that you just shared with us is very, very informative and insightful, and I really thank you for taking the time to speak to us today.
Absolutely. It's my pleasure.
Thank you. If you'd like to see this show again, you can visit our YouTube site, DFW Events, and as always, you can watch it there. And we hope that you join us for our June featured program, which is the Tanzania Nursing Scholarship Program. Same time next month, pretty much. All right, thank you all.
Thank you, your audience, all the Dining for Women members. They're supportive of Hope's program, and all the blessings for you.
Thank you, you too.